And joining me on the ward now is Chukwudi Analo, a medical practitioner. He joins me via Skype. Good to have you join us, Chukwudi Analo. Now, many people thought that by now we would have seen some sort of decrease in cases, or that we would have peaked and then start to see a decline in the number of cases. But so far, we're seeing an increase, a daily increase in number of cases, 25 million people infected. And what exactly is going on?
Well, thank you for having me. And I think with the way the case, that's why it's a global pandemic. We are seeing cases on the rise because obviously this community spread. But there's quite a whole lot of determinants that need to be factored in. Because, for example, India picking up in the last couple of days, you can see the population they've always had. You can see the way they live in clusters. So there are quite a whole lot of factors and determinants. And just how one of the WHO discussions where they were talking about the virus is got no break on its own. So it's about how much break are we willing to apply to this virus. And in casting this break on the virus, it depends on so many things in terms of things like social distance, hand washing. It depends on a whole lot of response. So why the virus continues to spread is just as much as we continue to ease the brakes. So the more you see people come back to doing what they were used to doing before, you start seeing this whole rise in numbers again. And when people become more conscious, you start seeing a drop again. So how people are using their mask, are they keeping to the various guidelines and all that? So basically, I think that's what you've seen globally. And it's just the fact that we are the ones who are responsible for applying the brakes to be able to curb this virus. So basically, we just need to do.
If I may just butt in, because you were talking so much about applying the brakes, but we're seeing countries like Nigeria and Ghana and other countries around the world reopening their airspace. So how worried are you? Because we know that this virus moves when we move. So how worried are you, or concerned are you that we might see this virus the numbers spike?
Well, with opening the airspace, where you have to start looking at the fact that what do people want to achieve? So I think those are questions that we need to ask. How long are people going to, because when you look at the economic toll, this is something that I think is about 2-3 years ago when I was attending one of the African Economic Summit, and I was making a submission because there was so much discussion in terms of economics, but nobody was talking about healthcare. One of the questions I was asking is, how much are we going to consider health? Now, I think the world has learned a big lesson to understand that if you don't have healthy populations, you're not going to have good economies. But now people are at that point where it's an outcome of how prepared were you prior to the pandemic and how fast are you willing to recover. So it's what reserve have you got to be able to carry on. Countries need to move on. A lot of things need to happen. School. So that's the key thing. So the question is, how much are you going to be able to close down? So that's a big challenge. And that's why at the moment, we can't continue closing down because a whole lot of other things need to go on. So it's about.
But if I may ask you, again, sorry to interrupt, but if I may ask you, whilst we can continue to lock down, we have to open up, and we're seeing that opening up all around the world. Schools are resuming, worship centers are opening up. We're seeing international airspace also open up. But how confident are you when you look at some of the measures that have been put in place, whether for schools or for worship centers and for domestic and international travels?
So, well, with that, you need to come to people facing the reality of their situation. There is no one standard method for every country because they are not all prepared at the same level prior to this. So, for example, in some developed countries, you can see that they already have infrastructures that can support home studies and all that. Whereas in places like Nigeria, you don't see that level of support and that level of development. So it's something that I think it's about listening to the experts and actually being honest and sincere in everything that people are doing in terms of both the government, who is the leader of all this response. So how honest are they willing to be to the people in telling them this is what we've got and this is what we can do, this is what we can achieve. And it's also important to tailor the expectations and what can be achieved, because at the end of the day, while we are seeing that more is being known about the disease and helping the healthcare professionals manage better, and we're beginning to see that the mortality is not as significant as this was initially, But at the same time, I think, like I said, we still need to be cautious and realistic with our expectations. I think that will help in what we can do, because if everybody just wants to continue copying what every other person is doing, then we're going to have a problem.
Medical practitioner Chukwudi Analo, thanks for talking to us.
Okay, thank you very much for having me.